So,
Okay.
and telling us we're live, and good morning, first of all. This is a special
Morning.
report designated as a special report. I'm very honored and excited to have Dianne Keech, the former Deputy Director of Department of Children and Families in Kansas, as our guest. Anybody that watches the show, as far as an issue that's going hand in hand with child trafficking, the God, USA Swimming, Larry Nasser is the problems that are occurring in really nationwide, not just in Kansas, but actually the Adrian Jones case is kind of one of the reasons that this show is even here. That was one of the cases that got us going. So let me just shut up and introduce Dianne and welcome Dianne, and thank you for being with us.
Thank you for having me, John.
And we had it was a pretty enlightening conversation, and what I found, with myself, though, I've done, a lot of, excuse me for a second, I'm just pretty enlightened back and forth here so I can monitor our chat room. But even with the amount of research that I've done, in child trafficking and so forth, I was under the misapprehension that maybe the majority of problems in DCF were occurring in the foster care side of the system, and just our conversation was very enlightening. I think that's a message that needs to get out. But I know you're very familiar with these two cases, both Adrian Jones and Evan Brewer. So can we kind of start with them? And I know you were working during when the Adrian Jones murder occurred. Could we start with that?
Sure. Just a little bit about my background. I spent most of my life in child advocacy type role. I started working in missions, in orphanages in Mexico, in college. And then throughout the years, I've just continued to work in child protection. So in Kansas, I spent 17 years in the field, on the streets, doing the hard work.
And forgive me, I should have mentioned your CV, which you sent to me, which is impressive to say the least. And obviously
I spent 17 years on the field, in probably the poorest, most dangerous gang kind of controlled area of Kansas, in Wyandotte County. And then I was invited to be the Deputy Director of Protection and Prevention Services for the state of Kansas for Department for Children and Families. So I went there in 2013. I was not working there when Adrian died. I had just given up my job. I had just, sorry, my brain is in a fog. I had just resigned a couple months earlier.
Oh.
And one of the reasons I resigned is because I felt like the department was not taking child deaths seriously. I felt that there was a cover-up in child deaths. I felt that the philosophy was lending itself towards child deaths, and I could not be a part of that. So that's why I resigned. And knowing that children were probably being abused over and over and over again and dying under my watch, gave me I had some real hardship with that. I couldn't sleep at night. And so finally my husband's like, you need to just get out of this racket. So I did. And Adrian Jones died a couple months later. I reviewed, for Fox 4 News, I reviewed his entire file. And what I discovered in that file is very disturbing. I know the current secretary and deputy secretary pretty well. I supervised the current deputy secretary, and I went to Washington, D.C. with the current secretary, and I offered to meet with them to talk about Adrian's case so that they would understand the root problems of why he died, and they refused to meet with me.
Wow.
So, and they continue to say in public that they did everything they could to protect him, which is not true.
Not true.
It's absolutely not true. Some of the things that are most disturbing about that case is that workers discover. So I think I have to talk to you a little bit about the process.
Yeah.
In child welfare, the process is the same for every state. They call it different terms, but the process is the same. Someone calls in a hotline, and then once that hotline is received, a worker has to decide whether or not to assign it. And then when they're assigning it, they have different options of how to assign it. Every state does. Or you can assign it for an investigation. And then another worker goes out and investigates, assesses the case, and then determines whether this child's safe or not safe, what risk factors exist, and whether the child needs any kind of services. It could be in-home services, or it could be out-of-home services, which is foster care. Once a foster care case has started, that opens the door for a whole new world. It's not the same. It's not the same workers who do investigation assessment that do foster care. It's completely. They're two separate branches of every single child protective welfare organization. So a lot of times when people talk about foster care, they kind of mix in the problems with investigation assessment as if that's all one streamlined thing, and it's not. They're two separate kind of services. Adrian Jones never made it to foster care. He was never ever in foster care.
Right.
So
Right.
all the problems with Adrian Jones' case lie within the front home services piece. So when a worker goes to a home to investigate abuse and neglect, if they discover a new allegation of abuse and neglect, they are required by law. It's called mandated reporting. They're mandated reporters. They are mandated by law to call in that abuse and neglect as a separate incident for investigation. So 3 times, possibly 3 times in Adrian's case, the allegations of abuse against him discovered by workers that were never hotlined in. So those workers broke the law.
Yeah, I remember with the fire department, we were required as a paramedic. I mean, not
Right.
only had you fill out your incident report, but you had to call the hotline.
Exactly. And so law enforcement did not call the hotline.
Wow.
So what they had is his little sister Bella had been physically abused by Heather. The exact mechanism we don't know, but that child had a subdural hematoma and presented at the hospital seizing. Doctors said this is a non-accidental injury. And so that means it had to happen through abuse. And during the course of investigating the case regarding his sister, poor little Adrian showed up with a black eye, split lip, cut under his eye, and bruises on his back. An officer took pictures, but never hotlined it. And the social workers did not hotline it, and it did not get its own investigation. This child of abuse or anything regarding Adrian. And the reason why it's important is because when workers look back on the history, they don't see that there was ever an intake of abuse, and they never see a finding. And this child was physically abused. During the course of that investigation as well, it was reported that he was being choked by his stepmother. That's a whole nother incident, right?
Right.
Reported a whole different time. Now
And
that
none of
incident of
these, none
choking,
of these were reported.
none of these reported, none of these investigated.
So just what you feared and you ended up leaving there was occurring.
Exactly. Exactly how I knew the department was engaging in investigation and assessment services with families. I've known it for, 17 years, how the department works. And so I had gone to DCF thinking I was going to make this great change. And when I realized that there was not going to be any change,
Hmm.
um, I was devastated, of course, feeling like I was powerless over this system when I should have had the power to make changes to protect kids. I didn't.
Yeah, that's scary.
So
That's scary when somebody in a position that high up is, basically powerless. That's
I mean, and
scary.
that's nothing to the powerlessness of Adrian,
Right, right,
right? I mean, this child, I had some power. I probably didn't know how to wield it properly. I don't know, but he had no power, no voice, nothing. And we need to be his voice. Another incident that occurred, and I think for anything that would um, make the family uncomfortable because I want to honor his legacy and the
yeah,
family.
yeah,
But another allegation is that he was sexually abused in his mother's home. Now, his mom had a long time substance abuse issue.
right,
Um, and what happens in cases, in situations in general, and I'm not saying this specific to his mother, but in general, people need to realize that substance abuse and substance addiction, substance use disorder is actually, we all know that it's connected to sex trafficking, but we've always called it prostitution, right? So
right,
when a is addicted to drugs, when a woman's addicted to drugs, how does she get her money for her drug? Eventually, if she's a working person, she loses her job. If you're a substance use disorder, right? You
right.
use until you lose your job, until um, sometimes you're homeless, sometimes you're living with friends or whatever, but you eventually severe substance use disorders um, lend itself to what's quote unquote prostitution that we know is really sex trafficking.
Yes, and we
So,
that was so important. And you made that link when we were speaking the other day, and people, I think, also had that misconception that, and some of these the cases where the children happen to be with a foster parent and are trafficked, or this one in Arizona, this fraud sham case in Arizona is one of them, but they get all the they get it deserved attention, but I
mhm,
don't think people realize that the substance abuse and that cycle where a lot of these mothers were trafficked, and the substance abuse is a symptom of that. Then they're
right.
substance abusers. But that you know when you made that connection, people really need to realize that they're keeping these children with these substance
Mhm.
abusing mothers, and
Right.
they're
So here's what happens on the front line all over America, not just in Adrian Jones' case, but all over America. What happens is you have a parent, a mother addicted to drugs who's giving birth to a child who's positive for drugs. Now, if you see, women in America know that drugs hurt their babies. They know that. It's public information. It's on billboards. I mean, you can't buy alcohol without knowing that, right? I mean, it's known to all people that using substances hurt unborn babies. So when a mom is addicted to the point where she is putting her child in danger that way, that is pretty significant substance use disorder. And why would she harm her unborn child? Because she's severely addicted, right?
right,
And where it usually is prostitution. So what's happening to these children is medical hospitals are calling in babies who are born positive for drugs. And across America, they are either being screened out for no response, meaning they just the agency closes the case and does not do any assessment or any investigation regarding a baby born positive. They have to prove that that the baby has been addicted to the drug, so that baby is a drug affected baby, which means there has to be, the medical person has to say this child's addicted, which is not very hard. It's not even the right language, but babies are often not born biologically, physically addicted. And so they have to prove that this child, is basically on life support and can't live outside the hospital, basically.
Wow. So just something, say, just having to give the baby a medication to detox them doesn't qualify.
That might qualify.
Hmm.
Yes, because that child have to remain in the hospital to detox. Okay. But if there is not a detox protocol involved, and most of these cases are not detox protocol, right? Baby born positive marijuana, there's not going to be detox. Cocaine, no detox. PCP, no detox. Meth. Alcohol, no detox. Meth. I mean, you can have all of the detox protocol for that child. Right. And so if the mom is child welfare defines safety basically as parental bonding. So if mom is bonding to that baby and she has a child carrier with her to take that baby home and some baby, diapers, they will screen that case out for no response whatsoever and send that baby home to mom. Huh. What's called newborn assessments. And they'll go ahead and screen it in for assessment, but then when the worker goes out to the home, it's the same thing. If mom is bonding to baby, if mom has baby items, they close that case. Or they might offer services, but remember, these services are always voluntary. And what addicted mom is going to voluntarily participate in services? Right. She's not going to. So, so these children are left in these homes with mothers who are addicted. And remember, there is a huge correlation between drug addicted mothers and prostitution, which we've always known. So what's happening in Kansas, that I know for sure, is that a lot of these times moms don't know who the dads are. Right. And whoever's in the hospital gets on the birth certificate. And frequently what happens is the trafficker gets on that birth certificate. Now that trafficker has complete control over mom, because he has complete control over that baby. And this is completely ignored by child welfare services, child protective services. They are just completely unaware. I've even talked to district attorneys and said, we have a problem with sex trafficking and you're in this area. And they're like, no, we don't. Because we don't have teenagers walking down the sidewalks, with short shorts, prostituting themselves. We don't have sex trafficking. That half of their cases are moms who are addicted and with no dad on the birth certificate, or someone who's not the biological father, and there's domestic violence. And by the way, when these children get older, there's always allegations of sexual abuse of that child. So now not only is the mom being trafficked and totally under the control of the trafficker, now you have a brand new, quote, I'm sorry to say it this way, but another piece of meat to traffic a baby. Yeah. Yeah. And we know that trafficking children, small children, even infants, there is a huge market for that. It's on the uprise. Where do these get these babies? Where do they get these babies to traffic? They get them from these moms who give birth in the hospital with positive drug tests on those babies, and they get to go home. Yeah. That's where those babies come from. Yeah. And I think
very few people realize that they're thinking it's some, and there are, because we've actually spoken with some of these people, there are children that get kidnapped off the streets. That does occur. But I would imagine on a much larger scale, are these everyday addicted mothers that have a broken picker. They're not going to pick a a father for the child, or a partner that is into anything good generally.
And by the way, a very clear mode of operation has emerged for these abusers, and we'll talk about this in the Evan Brewer case, is that not only do they have complete control over mom and child because he's on the birth certificate, but these men are actually threatening to kill these babies, and then bringing them back, and then doing it and bringing them back to life to control the mother. So, you can put a pillow over a baby or pinch a baby's nose and kill that child, and it will look like an unexplained infant death. It does not, you cannot tell by autopsy that there's been any foul play. And so I've had a handful of cases where the mothers actually reported this. So if moms are starting to report this in a handful of cases, I believe that it's probably way more widespread, because we know women who are victims of sex trafficking and domestic violence don't always have the courage to say exactly what's going on, especially in the presence of their trafficker. And so that's what happened in Adrienne Jones' case, and I've seen it in other cases as well.
Well,
I
Evan Brewer, that's what's
right,
documented,
right. And so here in Adrienne, going back to Adrienne's case, what you have is you have a mom who has a long history of substance abuse. That's in the records that are public, that were given to the media. And when mom, in one of the intake, in many of the intakes, it was lack of supervision, where mom was not providing care for her children. And in one of those investigations, a man with a baseball hat who wore the same clothes every single day was coming over to the house, going in the room with Adrienne and closing the door. And anybody with any normal education or anybody would know that that is a concern. Mom's not in the home, and an unknown man who wears the same clothes every day, is coming in to a child's bedroom and closing the door. Obviously, that's a concern of sexual abuse. And the worker never did hotline that, or that was never investigated. And that was a serious omission, another Class B misdemeanor committed by a worker. Serious omission, because again, when workers look at the history, they don't see an intake for sexual abuse. There was no finding, and there was no medical exam. In both of those cases with Adrienne Jones, with the black eye, the choking, the sexual abuse, those three things, the workers not only should have hotlined it for investigation, but once they got the investigation, they should have sent him a pediatric medical child abuse evaluation. And he never got one.
And there was furor, obviously, after that case became public. And then you see almost the exact same story with Evan Brewer.
Very similar story with Evan Brewer. The intake mom states that mom is using methamphetamines, and that she blows marijuana smoke in Adrienne's face to keep him calm. By the way, I want to take if you don't mind, a small little rabbit trail to talk about marijuana. I know that, there's a move across America to make marijuana legal. I'm not here to say anything about that particular thing, but I want to really make your listeners understand that marijuana is not a safe drug for parents who are parenting their children. I have seen child deaths with parents who are just using, quote, marijuana, unquote. I've seen horrible physical abuse cases with parents just using marijuana. Marijuana affects babies in utero negatively. And also, marijuana caused paranoia. I've seen youth, because I was in the system working so long, I've seen second, third generation people come into our court. And I'd seen children who had started using marijuana at 27. At 12. And by the time they're 21, they have full-blown paranoia disorder. And it is directly resulted to use of marijuana throughout their entire youth. So let me just ask you a question. If a mom is smoking marijuana and her baby is born positive, and hey, there's no problem, and you sent them home, what have you done? You've sent a mother home who has lower parenting capacity. So when you're smoking marijuana, you have a lower parenting capacity. So you sent a mom home. I think people forget how hard it is to parent a newborn. Take a newborn home for one day. That newborn is
And I know through my own personal experience, there is no safe mood altering substance for a substance abuser.
right.
Period.
There is no safe. There is no safe. So you're seeing this baby who has a lower capacity, and guess what? This baby has a higher need. So because this baby was born positive, right? This baby's had marijuana in his system. His brain is his synapses have grown together in a different way because mom used substances,
Yeah.
right? So you have a
Not
you
to
have a
mention the unborn child. There's no
right,
safe level of any mood alteration.
right. So you have a baby with special needs and a mom who has a lower parenting capacity. This is very serious that we are sending in America thousands of babies home with moms who are using marijuana. It's a problem. And it's one of the root problems of abuse and neglect. And that's so let's get back now to Evan Brewer's case. Um, so in Evan Brewer's case, the report was mom's using methamphetamine, blowing marijuana smoke in child's face to keep him calm, and mom's in bed unable to care for this child, which is very consistent with a methamphetamine using parent. They have when you use meth, you have a long period of awake time with extra energy. It's this high that goes on for days, and then you have a crash where you're just completely unresponsive for days. So it's very consistent report if they said that mom's in bed not caring for this child. That makes sense. And so it was screened in for an investigation. Worker went to the home. Mom says that she's sick and she has a medical condition that requires her to be in bed. And she has a list of 10. And of course, some of those prescriptions are opiates. And then she denies all the allegations. And Adrian appears bonded to his mom.
You mean Evan?
Evan, sorry. So Evan appears bonded to his mom. So in the record, it says if mom is using methamphetamines, child appears well cared for. And they close the case. So what's the problem here?
Oh my God.
From a common sense perspective, out in the community, what is the problem with how that was handled?
Well, I would think anybody with common sense knows anybody that is using methamphetamine can't use any other chemical successfully, number one, and that has no business parenting a child, you would think.
So, right. I think, your common sense is right on target, as does most people in the community. The first problem is they never established whether or not she was using meth or not because they didn't ask for a drug test. They didn't establish whether Adrian had been any drugs in his system because they didn't ask for a drug test. If you have a report and blows marijuana smoke in her child's face, you need to test both of them to see if mom's got any drugs in her system and whether child has been had access to drugs. I mean, if mom has been using meth and it's in the house and she's dead, asleep, non-responsive, what's to keep Adrian from touching or having contact with meth as well? It used to be in the 90s that if there was a meth case, that was standard protocol. That if you had a child in a home where there's allegation of meth, that you tested that child because
that would be why is that not being done? Because I would think that, okay, you grab somebody off the street and you tell them, okay, this is a scenario. The mother is suspected of using meth. It's reported she's blowing marijuana. I think the guy on the street would go in there and say, well, gee, what do I do? Maybe we should start with a drug test.
Yes. So common sense, right? I mean, I'm an expert in this in the sense that I know more than average Joe, but you only need an average Joe common sense to work these cases. So they did not establish substance abuse in that. And not only that, that they walked into a case where there's polysubstance abuse probably going on, like you said. So, okay, so they've got this report that mom's been using meth since his birth, by the way, was the report that she's been using meth since his birth. He's 2. That's 2 years of meth usage, right? And then you walk in and she's got these prescriptions for polysubstance for opiates. That's a huge red flag for me. That means these substance abuser, not just meth, but whatever she can get her hands on, probably alcohol, and there's marijuana, that marijuana, if the meth's out of her system, the marijuana is going to be there. And then so she's smoking marijuana and using opiates. That's a huge problem for me. And we're leaving this 2-year home.
Say that wasn't the case. Just meth alone. There are no recreational users of methamphetamine as far as I know.
Right, but meth gets out of your system relatively fast. So by the time, the hotliner calls it in, it gets screened in, they go the next day, that's 2 days. If this had been a problem the week before or 2 or 3 days before, it's conceivable that the meth would be out of her system because meth only takes about 48 hours. But if she's a longtime marijuana user, that's not going to be out of her system, and the opiates would be there too. So
I hear something crazy because I'm aware of some of the how some of the drug courts work and so forth. If you had somebody like that a child wasn't even in the picture, okay, they committed a misdemeanor and they got placed in drug court, they would be subject to random urinalysis. And it's not even, I mean, they're responsible for a child, and they not only are they not point tested,
right,
but there's no mechanism to random test these individuals either, I'm assuming.
What is consistent with Adrian's case and what's consistent with Evan's case is that in Adrian's case, he had involvement every single year of his life with Child Protective Services, and his mother had contact with Child Protective Services before he was born. Let's see, I want to say for 8 years before he was born. So mom had an 8-year history of Child Protective Services before he was born, and then he had contact every year of his birth. So that's a long time, isn't it? And in none of these cases of Adrian's, in only one case did they ask mom for a random UA.
And in your opinion,
not random. They asked, one random UA, and she refused to give it. And a month later, she volunteers a UA that was clean. So, so you and Heather was also of substance. There's also lots of allegations that Heather was using substances. That's the stepmom. So you have, this case is just fraught with substance abuse issues, both cases. And only one time did they ask for a random UA on one mother in this long history between both of them. So even if they did ask for a UA on this mom in Evan Brewer's case, if she's positive, then they need to do random UAs on a regular basis to monitor her, and that's not happening.
You would think,
no random visits.
Why, as of right now, with what you know of the system and how it exists, why isn't that occurring?
The reason why that's not occurring, it's the same reason why they documented if mom is using meth, Evan appears to be well cared for, is because they don't believe that substance abuse is a threat that requires children to be removed. And if we start removing children because of substance abuse, there would be too many kids in foster care. So one of the reasons I finally left the department is because I told my staff, we are going to start screening in children born positive for drugs. Because if you want to protect kids, you have to do it the earliest possible places of intervention. And baby born positive for drugs is that moment of intervention that needs to happen. And I had been getting calls from the community, from organizations, and even from tribal social workers saying, this Native American tribal social worker saying, We want you to stop screening out children who are born positive for drugs. We want you to address this issue. So I sat down and I said, okay, guys, we're going to start screening in these babies, and we're going to do good investigation and assessments to determine their needs. And every single person on my team said, no, we're not going to do that, because then foster care numbers will rise. And I said, I don't care if foster care numbers are rise, these kids will be safe. And they said, well, the community cares. We're not going to do it. And when my team, I was supervising them. They were supposed to do what I said. When my team said, no, we're not doing it, that's when I decided I was done. And they had gone above my head and gotten support from the deputy secretary. So I figured there's just no way I was going to get any work done on that. Um, so,
So they know that this is the case, okay,
oh,
and
they know that.
they know that you're right, but
Oh, I don't know that they know that I'm right. I think child welfare has gotten into this kind of group thing where they tell themselves, right? If you're in a situation where you're all telling each other the same thing, then you start to believe it. So
they're
I
not.
think they actually believe that substance abuse is not the threat that it is. I think they actually truly believe that children can be safely parented at home. One of my first, when I became deputy director, I went all across the state of Kansas and I met with workers and had meetings. And I met with this one worker in Wichita, and she said, yeah, I do in-home services, and I'm pleased to report this mom is using less. This mom has a newborn baby, and she's using less methamphetamines now than she was when we started.
Wow. And now they have two murders, and
And
really,
I was completely blown away. How do you know someone's using less meth?
yeah,
How can you determine that?
the rule of thumb.
Yeah, I mean, how do you know? You cannot tell. There's no way to tell, even from a drug test, whether someone is using yet less or more meth today than they were a week ago, except by parental report, right?
Right. And
So,
so now that they have, and the only common thread that I can see is substance abuse and the murders of Adrian and Evan.
no, you have physical abuse
Well,
reports that were not adequately investigated. That's another
yeah,
common thread,
but
right?
in what
So,
you're talking about, I mean
oh,
that
right. In the
you know,
substance abuse piece, that's a common thread. And also, a common thread with both of them is an absolute failure to follow the law. The law states that law enforcement and the secretary shall have dual responsibility to promptly and thoroughly investigate. And these have not been thoroughly investigated. They're just not they're not investigating them at all. There
so
is virtually no investigation going on.
do you see any will in because I see an absence of will not only in the general public but in obviously in the administrators of these agencies to I mean, and it's huge. I mean, what needs to be done is I can't even imagine the work that it's going to take and the investment and the time, but I don't even see the smallest amount of will to do it.
No, I don't either. All throughout the country, in fact, I don't know if you've ever heard of Eric Dean in Minnesota, the boy they couldn't save, but that was the same problem there. They failed to do an adequate investigation of that child situation. That child died. Right, there's another case in Minnesota that's very similar. There are two of them right now, two child deaths. If you just start kind of putting a Google alert for child abuse neglect deaths in the country, you will notice that these are all similar patterns across the country. Children are dying because there was not an adequate investigation regarding the number one red flag that a child is going to die. Do you know what that is? They've had a call to the hotline previously. That's the number one indicator that a child is at risk for a child abuse neglect fatality, is
and
that they had previous intake with the department. And in
explain.
that,
Yeah, I'm sorry, go ahead. Go ahead.
what you need, okay, so when you look at the data, the number one indicator that a child at risk to die, they well, usually they're under the age of 7. The vast majority of children who are perishing are under the age of 7. They're not school age, and they had a previous intake with the department. That tells me that the first intake should be the last intake. We need to investigate that case to ensure that that child's going to be safe. And that's not happening across America. This is an American
Absolutely.
issue. And why? What's happening that every single state is behaving in the same manner in which they are not adequately investigating cases. And I'll tell you why. It's because there's a federal mandate to reduce foster care.
Yeah.
That's why. And the people agree with it. The people don't want children in foster care. They believe the root problem of all child protective issues. So therefore, if we lower foster care, then we're actually not having a problem anymore. And that's simply not true. I handled almost 1,000 foster care cases while I was in the field. And only less than 10 cases, I want to say about less than 5. I recall 5 cases where children were harmed in a foster home after they came into foster care. 5 out of almost 1,000.
Mm-hmm.
These children were in good foster homes. They had a chance. Children who have early intervention, especially infants who go into a good foster home, have a better chance of becoming a happy, safe, contributing member to society than children who are left in their homes to be abused over and over and over and over and over again, who finally end up in foster care because law enforcement intervenes. Those children then come into foster care and they're mentally ill. Now their chance of becoming a happy, healthy, contributing member of society goes way down. We know that through the ACEs study, the adverse childhood experience. I want you to think about it this way. What social problems in America concern you?
That's it. Child trafficking, child welfare. I don't care about the rest. I mean, I really,
What about what
that's just
about
me.
substance abuse? Is that a
Well,
problem?
yeah,
I mean,
it's a part of it.
I mean,
It's all,
that's a part of it. So think about every serious social problem we have in America: poverty, substance abuse, domestic violence, child trafficking, sex trafficking of women and children across America. Um, I want to say criminal, the crime rate, as well as numbers of people in prison. When you look at every one of these social problems, I can need to go into any jurisdiction and review the court system as well as the child protective system. I could prove to you that the reason that we have these social problems escalating in America is because of child welfare's refusal to protect children at an early age. Let me give you a couple of the examples. Kansas, they passed some laws in 2012 and 13 and 14, and well, they continue to pass laws to protect sex trafficking victims. And one of those laws required DCF, the Department for Children and Families, to respond to law enforcement if they had a reasonable suspicion to believe that a child was a victim of sex trafficking. So let's say police are doing their job and they see a kid and they're like, oh my gosh, I think this kid is a sex traffic victim. Then they call DCF, and DCF responds by sending what's called a rapid response team to assess that child's safety, placement, and treatment needs. So we started the rapid response team in January 2014. Our first call came in March or April of 2015. So in April 2016, sorry, yeah, 14 to 15. So in April 2015, I reviewed the first 50 rapid response intakes that DCF received referred from law enforcement. And what I discovered is, first of all, 98% of all of those children are Kansas residents. I think the public thought that,
Yeah.
trafficking to other
Yeah. On the
kids,
highway.
and they're just being transported through I-70 or I-35 through the state, but it's not actually happening in our state, right?
Mm.
Because people think of sex trafficking as children who are stolen, kids coming from other countries. They don't really think of it as a local problem. But these were all kids born and raised in Kansas.
Right.
The second thing that was very clear in my study, in my review, is that 80% of these children had previous history with DCF on the front end. We all know there's a correlation between foster care and sex trafficking, but that's too late.
Right.
It's too late then. We've missed our opportunity to do prevention. The real prevention piece is when that child's born, when there's a sexual abuse call, where there's a physical abuse call, when these children are little.
Yeah.
Right? And so 80% of those kids had a previous intake with DCF, and DCF failed to protect them. 80%. I mean,
And
if I could tell you right now that we could end 80%, we had power to do prevention on 80% of the cases in Kansas, would you jump at that?
of course, and I think nobody sees the cycle that's producing. Why is this an epidemic? Because it's been untreated for decades, and
Yeah.
you
Because
create more victims. You create, and we don't know why some of those victims turn into abusers. Some of them become survivors. We don't know about that, but
well, there's a huge, and I'm sorry to say this, but there is an overlap between becoming a survivor and an abuser. Because you're forced to. I mean, listen, if you are being controlled by a trafficker and you're made to commit crimes, and then you believe that there's no way out because you're also a criminal. Many of these people don't even see themselves as victims,
right,
right?
right,
And then they're required to participate in the trafficking,
yeah,
right?
and what's
So,
your
and once you start doing that, you don't see yourself as a victim anymore. You see yourself as a perpetrator as well,
right?
right? And so the
And
line is
I
very
totally,
blurred.
I totally agree with
That
you
cohort
because
is so strong.
to break that cycle, that's the best place to break it. There's a lot of other things that affect that cycle, but
The best place to break this cycle is when a child is small and their mom is using drugs. That is the best place to break the cycle.
I totally agree. And I
Mm-hmm.
think that's the only chance that we have to break it.
Only chance, in my opinion,
Yeah.
a real chance to do prevention.
So how do we accomplish that?
That's the golden question. Um, so first of all, we have to do a lot of what we're doing here today. And that's why I'm really excited to talk to you, is because first we have to do awareness, right? We have to talk to people, let them know that this is what's going on. We have to convince the public. The second thing is we have to convince the public that it's not okay to reduce foster care for the sake of reducing foster care, right?
Right.
Um, that's the second. When you look at the media and how foster care is always portrayed, there is hardly ever positive. Do you ever hear positive stories in the media about foster care? Do you ever hear it in movies? Or I think about one of my favorite shows is Mom. Do you ever watch that show? Um,
I can't say
Mom
I
is
don't watch a whole lot of television, period.
Yeah. Well, I'm a Netflix. I will get on Netflix when I'm sick. And I recently had a month of pneumonia. And so I spent some time on Netflix. And I confess that I watched a lot of Mom. Actually, I think it was Hulu. And what's interesting is that the grandma in that case, the reason she's a drug addict, these are two drug addicts trying to recover. And the reason grandma says that she's a drug addict is because she grew up in foster care and she was placed in foster care at age 3. Um, that's just not true. 3-year-olds do not stay in foster care their whole lives. 3-year-olds get adopted.
Yeah.
It's the same thing with Once Upon a Time, that Bella I think her name's, I don't remember her name, Bella Swan, I think, maybe Belle Swan. She is the main character. And she has all these issues because she was raised in foster care. And she was put in foster care as an infant. There's no way an infant goes through foster care their whole lives. Infants get adopted immediately,
Yeah.
usually into really loving, good homes. And so when you look at how the media presents foster care, they always they just have a very wrong perception. And we really need to have awareness of what foster care is, who foster parents are, yes, in foster care, and they need to be addressed. But that's not the whole of it. That's a very small piece of foster care.
Well, I think our society tends to break down into camps. You know, we see this over every spectrum, and then that's what I try to fight against. You know, that you know, yes, there's egregious things that have happened in foster care. Yes, there's egregious things on both sides, but you can't, for lack of a better analogy, throw the baby out with the bathwater. I mean that when you start breaking down into these camps where all foster care is bad, or you cannot have these babies with their parents ever again, you know, that's just not the
right,
case, you know.
right, right. It's, you can't do black and white like that. Exactly.
Yeah.
And there is a, I'm happy to report. I believe that the answer is volunteer placements. I believe it's time for the church and other communities, the faith community, Muslims, Hindus, wherever your community is, Jews, it doesn't matter. But I believe that there is a place for faith communities to rise up and do volunteer placements where they're not getting paid. The root problem of all of this is money.
Money.
Adrian Jones and Evan Brewer died so the state could save $66,000 because it's $33,000 a year to place a child in foster care. So these children died in order to save $33,000 each. The ironic thing is neither of these kids needed to go to foster care because they had relatives who would take them without foster care. So dad, he doesn't, that Evan could have been living with his father and been safe and happy right now. And Adrian could have gone to live with his grandma. There's no reason for these kids to go into foster care, right? So Kansas, number one, needs to, and states around this country, they need to identify relatives, fathers, first of all, of course, and grandparents who are willing to take these kids without foster care. Now, you still need court involvement because what they do in Missouri, which is a travesty, is when a case like this happens, they will give the child to a relative without court. And then there's no final custody, right? So that parent can go get those kids back, or those kids go from relative to relative and they don't have any permanent home. That cannot, not asking for agencies to just take it to another relative and let that child be passed around. No, there needs to be a court case and a relative given custody, and the parents need a reasonable time to try to reintegrate. And if they don't, then those children need to be given to those relatives without foster care ever being involved. There's no reason for foster care. If you have grandchildren and something happens and your grandchildren need a place to live, you don't need the court to, I mean, you don't need foster care.
Yeah.
You just need the court to do custody.
Right.
Right.
Common sense.
Don't need
Quick.
Common sense. So, you know, there is one little bit of truth to what the community believes about snatching kids and putting them in foster care for money. I've heard that for many, many years. It's just so not true. Child protective workers are trying to reduce foster care in order to save money, and because it's a federal mandate, they are required to keep 90% of all the kids in the home. If they don't comply with that, they're out of compliance with federal outcomes and measures, and we are at risk for losing federal dollars. So there's no incentive to put kids in foster care. However, once kids are removed from their home because of safety reasons, they're only placed in foster care. That's the problem.
I think that's where people don't understand it, and they see something like that and they say, oh, well, they're shoving them in, they want, or the policy is set up to do that.
Right. And so
They
that
never
is
get
what,
out. It's like once they go in, they never get out.
yeah, there's no reason whatsoever to place a child in foster care if they have an appropriate relative who is willing to care for them. But that relative needs legal custody. And then we need, then the department can give case management to the mother and the court oversees arrests. But that child doesn't ever need to be in foster care. And that's my problem is why do we always go to foster care? Because that's where we're pouring the money. We're pouring the money into foster care services. So if a parent needs services or a child needs services, the money is associated with foster care. That should not be. Relatives should have custody and
Here,
be supported in
here's,
that.
here's a question for you. Why do you think that that's being done? Because and we see that over and over again. It's like in these two cases, Judy Conway, the father of Evan. I know more people than I can count on both hands that have, after they've been placed in foster care, they can't get access to their children, and like grandmothers and even mothers who have um, gotten substance abuse treatment and counseling and so forth. Why is that occurring?
Can you repeat that question? Because you said grandmother. So I was
Well,
confused about.
it seems like, and you were just kind of covering that, in both Adrian and Evan's case, that you had competent relatives that could have taken care of both of those children. I've seen that, our own experience, the people we run into, with the show and et cetera, that it seems like the same story. Once they are kind of into that system, or DCF has intervened, that the competent relatives can't get custody of these kids. Why is that?
Okay, so let me, I'm going to break it down a couple ways. Remember, we have two systems, right? Not
Right.
so the first system is the investigation assessment system. And then they close that investigation assessment and place kids in foster care. And then you have a new system. And they have different rules, they have different workers, different players, different processes. So I'm going to talk about both of them. But I just want you to be aware that there are two systems. So the first
Yeah.
system is investigation assessment, and what's going on in these cases is they're encouraged to be partners with the parents they're supposed to be investigating. So um, there's a book called Signs of Safety that was published in the 1990s out of New Zealand. And it has become the gold standard philosophical framework for child welfare in America. Even if a state does not adopt signs of safety as their official program of intervention, it's still the philosophical underpinnings of child welfare today. And so, what Signs of Safety says is that investigation is bad, it's punitive, it's paternalistic. It makes parents feel bad. What you need to do is partner with parents. Okay. So this happened in both Adrian's case and Evan's case. And it's another number one core died is workers come into the home and they actually say, I'm not here to investigate you. I'm here to help you and provide you services. So how can I help you today? And if you approach it in that way, their goal is to make friends with the parent, in order to gain their cooperation, in order to convince them to participate in services. Once you get services, then this child's safe, right? Um, the problem is all this is voluntary. When you have addicts, they don't voluntarily want to do anything.
Yeah.
So the problem here is you cannot ask parents. So these moms don't want dads involved, and these moms don't want grandparents involved. That's the bottom line.
Yeah.
And the moms are the ones determining,
Yeah.
have control, because you're partnering with them. You're partnering with a mom and you say, partner, and you get to participate in this process and kind of You get to determine where we're going. So what do you want to see happening? What do you see as the problem? What services do you want? Do you want dad involved? Oh, you don't want dad involved? Okay. I want to engage with you. And so I don't want to break your trust. So if you don't want dad involved, dad's not involved. If you don't want grandma involved, grandma's not involved. And in both Adrian's case and Evan's case, it was the grandma and the dad calling the hotlines.
Yeah.
So of course they don't want grandma and dad involved because they're trying to protect the child, and the caretaker who is putting the child at risk doesn't want them involved. So that is why these relatives were not given the opportunity. If child welfare had said, this is how I would handle those cases and how I did handle these cases, thousands of them, I come to the home and I say, or I have them in my office. I actually don't have a lot of negative conversations with parents in their homes for safety reasons. I will go and observe the home, then call them to my office for a meeting, and I will say, you know, we're involved. And because of these risk factors that I have found, your child is at risk for going into foster care. I don't want your kid to go into foster care. What I want is your kid to be with a relative or with dad. So why don't you give me that information? And we're going to do a safety plan that if you have another positive UA, you will agree that these kids go to live with these relatives, will get court involved, and you don't lose your kid to foster care. That conversation I have. And I'm never, well, I've had parents say, oh no, I don't want my kids with so and so because they're not safe, yada yada. But I want my kid with this relative. So then, because you have to get the parents, this is confidential, right? You can't just be calling relatives and telling relatives. You can't call grandma. You can't call dad because it's confidential.
Right.
That's one of the things that needs to change in the law. I believe that once an open services case has begun, like for family preservation or family services, any kind of services, that grandparents and parents have a right to know. They have a right to know that this is going on, in my opinion. And then they need to be notified, right? And so they can participate in case planning. They can be part of safety planning. So that never happened in either of these cases. And except that Adrian was, that's not exactly true, sort of true. When Adrian was removed from his mom because of lack of supervision, they placed him with dad, but they didn't do an adequate investigation of dad to realize he was inappropriate. So they did place and they also didn't give him legal custody. So it didn't go through the court system, right? They just gave him to dad and told dad to go get custody. Well, dads don't necessarily have the ability to walk in and get custody of their kids. So I think that what I would have done is said, well, first of all, I would have done a very good investigation of Heather and decided, and dad, and said, this isn't going to work. We need another relative as appropriate. Give custody to grandma with court intervention and allow grandma to get eventually guardianship of those kids or adoption. That's what needed to happen in that case. And it didn't happen because mom didn't want it to happen.
Right.
And the worker is engaging mom and trying to get a partnership with her going. Same thing in Evan's case, right? They go to the home and they just ask mom, are you using meth? No. Okay, we believe you.
Dianne, let me just interrupt you for a second because I probably should have thought about this, but we have clearly identified the problem, and it's my hope that your expertise is going to get out to as many people that can watch it and comprehend it. And there is the old saying that the mind, what the my old parts can can handle. That's about the best way I can put it. So would you mind, this could be a series. I know we haven't had a chance to, and as we put these out, we do some shows, and it seems like the longer the show, the less views. But I think we've covered a tremendous amount of good ground in an hour. This is series because I want to hear about safe review. I want to hear about, how, your direction on how we proceed on a local level, and it's just, this is just too big to be in one sitting. Does that sound like something?
Yeah. Yes. I
You
appreciate that because these things are so complicated. You can't really talk about it in a 15-minute blog, or, it needs to have some time to actually, um, talk about these things. But I believe that there are solutions. Um, and I would love to sit down and talk about what I think those solutions are. Um, so if we want to do that at another time, that would be great.
okay? And put out your on, and the way you were explaining, do you want to just give people like a little kind of a snapshot of what safe review is all about, and we'll
Sure.
maybe we can get into that, in our next segment of the series.
So SAFE it stands for Safety Analysis Follow Empowerment to keeping kids safe. It can be used in a child welfare case, but also can be used in counseling cases. What it does is it just encapsulates common sense, dictionary definitions, and common sense around safety for children. And anybody can use it. It's free. It's a free resource to anybody who wants it. It is. I ask you not to change it or sell it, but it is free for use, and you can find out more about it at www.safeconsulting.org. So that's SAFE consulting.org. You can get more information about SAFE there. It is my call to Child Protective Services to return to classic child protection investigation and assessment practices. And it's my way of building awareness to the community about what safety really is, and how to hold child welfare accountable.
Hopefully we can do this busy, but if we can, maybe soon go over into the making them accountable, and we've seen, just in all the different issues that we cover, and unless we're starting on anything is just not happening. So I look forward tremendously to that part, because that's what everybody wants to know. That's what everybody needs to know. How do we right now? You still with us, Diane?
So sorry, we got interrupted a little bit.
Yeah. Sometimes the Wi-Fi. I'm in the middle of nowhere, so my Wi-Fi goes kind of in and out. But what I was saying was, I think that question, how do we make them accountable, and it very good ideas on how we can do that now. And so when we cover our next segment, hopefully will be the information we'll be able to get out.
All right, good deal. Thank you so much for having on it. Good questions. I appreciate you delving into the subject.
All right. There, we say thank you everybody that joined us, and we'll be hang on just for a minute, Diane. Thank you.
Okay.
Obviously valuable.